Hello, everyone. This video is a short walkthrough of the radiology section of the 2022 CPT manual. Make sure you have tabs, highlighters, everything else you're going to need to effectively mark up your book. So if you haven't already, make sure you place your tab. It's on page 521. And this is where the table of contents begins. So you might notice that this is looking a little bit different from previous sections, and that's because we are no longer in the surgery section. Radiology is its own section of the ICD-10, and it is set up a little bit differently from the surgery section. So with that in mind, this is going to be a very quick overview of what the section actually entails. And then I'm going to make some more videos that are going to actually break down how to use this section. So why would I bother with that much work? The reason is because if you review the AAPC website and look at what their requirements are for the national exam, you will see that they are pulling 6 questions just from this chapter, or this section rather. Additionally, they will pull 6 questions from the following 2 chapters, which is going to be the laboratory and pathology and also the medicine sections. So we are going to spend a good amount of time breaking down these sections. And in order to do that effectively and not burn you out entirely, I'm going to make the video shorter and make sure we're just covering one topic at a time rather than trying to rush through and learn a whole section all at once. Okay. So let's get started. Like I said, it's going to be very, very short and there will be more videos. Okay. I'll just try to make sure this can focus. Okay. So one of the things you might see here, we do have our own guidelines section. And the guidelines are very, very important for this section. So there's some overlap with surgery, some general guidelines for the whole manual, but these are specific to radiology. So I would encourage you to read through every one of those guidelines. It's only 2 pages, but really make sure you understand the guidelines for this section. And we will do some of that together in other videos. The next thing you might notice is we do not have the same format as we're familiar with in the surgery section, incision, excision, repair, all of that we normally see. Instead, for this section, we have a service or procedure, and then we have the body parts or the body system on which that procedure is being performed. So what's important to know first? The very first thing that's important to know about this section is what is radiology? So radiology is a specialty that basically involves imaging that can be diagnostic or therapeutic. And we'll get into more of what that means. But the basic thing that you need to know is that radiology is a specialty that involves imaging, okay? And the specialist that works in this section or with this specialty is the radiologist. So I'm sure you've heard of that. And those are the physicians that would interpret the images or the imaging that we are obtaining from these different services. Additionally, you will have technologists. And it's important to understand that a radiologist is not always, or even most of the time, going to be the person performing the service. They are usually going to be the person interpreting the service, okay? So it's important to know right from the beginning. We're just going to do a quick walkthrough of the section, and then we can get more into the details in future videos. So like I said, we start with a service, and then we have the body system or part of the body that we are working to be able to visualize, okay? So we start with head. So right here we have the diagnostic radiology. So this would be imaging in order to perform some kind of diagnosis. And then we go head and neck, chest, spine, upper extremities. So that's following that top-down pattern that we've seen before. we just start at the top of the body and we move our way all the way down, okay? So that is going to be a little bit more familiar. And then that's going to repeat itself. So we'll have diagnostic radiology, diagnostic ultrasound, and then on the next page, we'll get into radiologic guidance, breast mammography, bone and joint studies, and then radiation oncology. And radiation oncology is going to be things like radiation treatment or proton beam therapy, things that we're doing to treat cancer. Okay, so if you want to make a note of that, that might be helpful for you, or you might want to put it in this code section if you want to. And then we get into nuclear medicine, and that is divided by diagnostic and then therapeutic on the next page. And that's it. And I know I say that's it as if that's not a ton of codes. There's obviously a lot of codes in here. Then we will have, like I said, our own guidelines for this section. And there's quite a bit in here. You can see I've written a lot of notes, underlined quite a bit. And that's because, as I said, it's its own section of the manual. So it has very unique, specific guidelines and rules we need to follow. So we will work through the majority of these together. It's important to note that we do have an unlisted services section. This can be helpful on the national exam if you're very quickly looking for an unlisted service. This can be helpful. And then the other quick thing I can point out here is the definition of what foreign body or implant is. So this is helpful to know whenever we're reading our documentation. If we are removing a foreign body or an implant, they could be the same material. Okay, they could both be a small piece of metal or something like that. What makes them different is a foreign body is not intended to be in the body. So they're unintentionally there. So maybe there's some kind of traumatic event that happens, or some other way that this got into the body unintentionally, or maybe intentionally by the person swallowing it or something like that, but not for medicinal purpose or therapeutic purpose. An implant is placed by the doctor or the medical team intentionally for a medicinal or therapeutic purpose. Okay, so that's the difference. And that's just a helpful thing to know because in this section, you will often see implants. And so that can get a little bit tricky to kind of understand what the difference might be, especially if it's something very, very small, some kind of marker, something like that. So that can be helpful to at least know the difference between what is a foreign body and what is an implant, okay? And that does help, again, when we're talking about removal of things from the body. So we can remove an implant, we can remove a foreign body. It might be a very, very similar procedure, but we want to make sure if the codes are differentiating between the two, that we know what the difference is. All right. Again, lots of guidelines here, a lot of things we will get into. And then we're going to get into our regular codes. And it'll look just like what I said when we walked through the table of contents. We start with diagnostic radiology, then we go head and neck, chest, spine and pelvis, and all the way down the body. You will notice that there are some really good illustrations in here as well. If you find one of them particularly helpful, go ahead and put a tab on it, okay? And then we get into diagnostic ultrasound, and that's going to follow that same pattern again. Bone and joint studies. Radiation oncology. So again, if you want to put in here that this is a treatment of a malignancy, that might be helpful. Just so you remind yourself while you are taking that national exam, if you happen to be working in here, you can have a really quick note for yourself. And the big thing that you're going to want to note in this section is the method of delivery. So occasionally, just like we've seen in previous sections, we'll have very, very similar codes repeated throughout each of these subsections, and the difference is going to be the type of delivery of that treatment. Okay, so we'd have neutron beam or proton beam. Okay, which is on the next page. So that's what's important to note here. And if that's something that you struggle with or might be confused by, make sure you highlight the keywords in there. And you can't see that, but it says neutron there. Yeah, I don't know if you're going to get to see it. It's a little fuzzy. But that's what's important to note in this section. There is a helpful chart here on page 564. I think it's most helpful when you're actually working heavily in this section. But there are a few things that we will get into, particularly this column here, that will be easier to understand by using this chart. So this is something we might look at a little bit later, but usually when we see these big charts, they're most helpful when you're actually working in this section rather than looking at preparing for the national exam. Then we get into nuclear medicine. And that is going to go by system. That might be helpful to note. Again, it'll be diagnostic as the subsection, and then we'll have it by actual body system. So endocrine, lymphatic, gastrointestinal, cardiovascular, musculoskeletal, and so on. And then we have a therapeutic section on 573. That's where that starts. And that's pretty short. And then at the end here, we do have a great section for notes. So that might be helpful for you, particularly because this is a little bit different section. It can get a little complicated. So it might be helpful to put section specific notes right here, particularly things we're going to talk about in the upcoming videos, and then give yourself a little tab. And I would just even make it radiology notes. And put that there for you. Okay, well, I should probably put it on the next page so that way I turn right to it. Okay. All right. So like I said, super, super brief, but that is because there's more to come and we are going to get more into quite a bit of this material. All right. If you do have questions about what I've covered right now or specific things you're concerned about with this section, please let me know and we can talk about it some more later this week. Thank you.